Welcome to VBF's first International Vascular Birthmarks Facebook Live session from Milan, Italy, with myself and world-renowned vascular birthmarks expert, Dr. Giacomo Colletti. Say
Hi,
hello.
hi,
I
hi,
didn't,
everybody.
yeah, apologize, I didn't see the go live session notice. We have an exciting announcement tonight to make to everyone. I'll be making it repeatedly. Dr. Colletti now has access to a pulse dye laser and will be offering PDL treatments for anyone with a port wine stain or hemangioma
Right,
for a flat fee of $500
right.
without anesthesia at any age. So, starting from infancy up through adulthood. So this is really, really exciting because I know a lot of families from Europe have been traveling to the United States to get these discounted sessions. So we're really excited. And again, I'll be making this announcement throughout the night. Um, is this how you scroll up and down? Because the questions are going to
Yeah.
start coming in. Hi, Josie. Josie's our VBF Europe manager. So, Josie, I don't know if you just heard, but I just said we now have pulse dye laser treatments being offered in Milan, Italy by Dr. Colletti for a flat fee of $500 per session, no anesthesia, and treating children any age. So, from infancy right through adulthood for port wines and for hemangiomas, any kind of cutaneous
Oh,
vascular
yeah.
birthmark. So anyone who's interested, uh, April can post Dr. Colletti's email, or they can email me directly at vbfpresident@gmail.com, and I will put you in touch with Dr. Colletti's staff to schedule these are people sending us loves and hugs, to schedule,
That's the first time for me, so
yeah,
just try to understand me.
yeah. So, hi, Amanda. Let me see somebody on. I see Jody. Hi, Jody. And Joni. And hello. So, everybody, we're ready to start taking your questions. But also,
Yeah,
again, until the questions come in, we're excited to announce the pulse dye laser treatments will be available in Milan, Italy, in Dr. Colletti's private practice. Will they be offered in your office?
yeah,
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 with the pulse dye laser for a flat fee of $500. I don't know what that is in euros.
yeah. Slightly less than $500. It's
Yeah,
gonna be, I think, 450 euros.
450
Yeah,
euros.
450. Yeah,
All right, I'll start saying that 450 euros. So this is excellent for families from Europe and anywhere that want to travel to get early treatments for infants and toddlers, adults. No anesthesia. You'll be using
no
the
anesthesia, just
topical.
low numbing cream.
Okay, so we're ready to take your questions. I see we have 25 people are logged on, so we need to see.
Hello to everybody.
Yeah, we need to see your questions concerning a vascular birthmark. I know you're all on there, so start posting your questions for Dr. Colletti. Sometimes there's a little lag in when they write the
Yeah,
question and when
okay.
we see it, and you may have to, is this
To
the,
scroll down, yeah.
yeah, oh, see, okay, so
Yeah.
here we go. Um, Kristen saying hi. Is there a connection between vascular anomalies and anemia?
Yeah,
Chris says.
not really. I mean, unless the vascular anomaly is causing some bleeding, then the bleeding could be the cause of anemia. But there is not a connection between a vascular anomaly and any kind of anemia. Mm, beside of this, no.
Okay. And I mean, I wonder too if what if it's a really massive, extensive one, like with KHG, or, I mean, could that, like,
Yeah, in cases, maybe it is not described, but it might be that in cases of HKHE, where there is a massive consumption of platelets,
mm-hmm.
there might be some consumption of red blood cell that could cause some anemia, but this is not described actually.
Okay.
I think that anemia in vascular anomalies is only caused by bleeding. Yeah.
Okay. So Joni wants to know, is there any advice for adults with AVMs? So that's your expertise.
Yeah, well, yes, but it depends. Me, and Linda, and Dr. Weiner, and others, we are working on a staging system because you cannot just talk about an arteriovenous malformation. You have to know what's the extension of the malformation, what are the symptoms of the malformation, and whether there is an indication for treatment for that typical, very specific AVM. So I would need to see the single case, and in that case, I would recommend treatment or not. And also, I should say that there are various types of treatment, so I should see the patient first.
Right, and Joni, you can send your pictures to Dr. Colletti through birthmark.org. He's one of our experts on our page, and April can post his email. I think you can do it through birthmark.org/Colletti. So, or she can just post it on here, and then you can send him your pictures, or you can send them to me, and I can forward them. And Jennifer, regarding should we post a picture, you can't post them during Facebook Live, but you can definitely, when we're done with Facebook Live, send them to me or directly to Dr. Colletti. We will be posting his email on here. We have it available through our VBF website, and he's happy to review your pictures and provide a consult. Jeff Bergen has an extensive port wine stain, and he has tissue hypertrophy, and he'd like to know your thoughts about treating this tissue hypertrophy. He's had a number of laser treatments, but he has some thickening in the lip and in the jaw area.
Okay, so that when you just have residual remnants, I would call them, then it's not really about a vascular anomaly anymore. That is something about plastic surgery. Then the role of surgery in these cases is to remove the redundant tissue and concealing the scars where naked eye cannot see them. So I would go for surgery in those cases.
And I actually told Jeff that, he could send you his pictures because in your practice here, he felt pretty confident, like even possibly coming here to have you do it in your.
I would be glad to.
Yeah, and give him an opinion and cost and so forth.
Yes,
because it's out of pocket for so many people in the country that it may be more cost effective to come and see you.
I'm pretty sure.
Yeah. So Joni wrote us about the AVM. So she's saying she has a large one in her leg and knee, and sclerotherapy hasn't worked.
Okay. Sclerotherapy is a word that means so much and nothing. Because sclerotherapy just means injecting a substance inside the vessel, but I should know which substance was injected and the amount and the concentration of this substance, because when I do, I don't like to call it sclerotherapy. I like to call it alkalization. Injection of pure ethanol, because ethanol, in my opinion, is the only thing that is going to work with AVMs, while others, more mild sclerosants, are going to be effective in venous malformations. So I should see your case, Jeff, and I need to know which sclerosants were used to try to treat your AVM.
Okay. Yeah. So
Joni, sorry.
Right. And so now we have Mahela, who we've seen before. Her daughter has a port wine on her face. Sorry, I forgot to write. I'm not sure what her question is. Let me see. Angelo Solidio, thank you for your job. Maybe someone you know. Jody Lee, let's see. Yeah, that's her. Oh, is the same laser that Dr. G uses the one that Dr. Colletti will use in Milan? Because we go to New York for treatment, but Italy is so much closer, but now we finally have great results. So I'm just wondering, will the results be the same in Milan?
Yeah, the laser is likely to be the same. because I have chosen with Linda just to rely on Candela PDL laser, which is the very best that we have in the market today. As far as the results are concerned, I would say um, probably yes, or
You can also, Dr. G will probably give you this exact settings he used for her daughter. I
yeah,
bet he would. You
I
could ask him.
I already
Oh, you did?
yeah,
Okay.
I already asked him.
Yeah,
So
for the setting.
I think yeah,
Yeah,
the final result would be pretty much the same,
yeah,
taking into consideration that
yeah.
Roy Geronimus is
Best in the
the best
world.
in the world. So
Yeah,
yeah,
yeah.
we're learning from him.
Well, and you
But
could try one in Milan,
oh
and
yeah,
then she'll be getting the one from Dr. G in Greece because they follow us wherever
oh
we
yes,
go. And you could see for yourself, Mihaela. And yeah, it'll be good. It'll be good. You saw Dr. Colletti in Italy, anyways, in June. He was there.
yes.
Okay, so there's okay. Her daughter has port wine. We've already seen that. Jeff said thank you. Okay, here's one. My granddaughter goes next month to see about removal of this hemangioma. Very worried. Does this look like it could be removed safely? Well, we can't see a picture, but are
You
there?
can, but you can write to me to my email.
And we've
So
posted it above here. So
yeah,
your email is above, so she can
yeah.
just look above.
Just send, yeah, send the picture to my email. I will review the case and I will tell you my opinion on what should be done on your granddaughter.
And remember one thing, Michelle, like if Dr. Coletti says he can safely remove it, but you're having it done by a doctor in the States or somewhere else, you can't speak for that doctor. You only know what
Oh yes,
you can do.
no,
So you
no,
have to understand that.
surgery is different. You cannot just say surgery. The surgeon has his own technique,
Right,
and well, results are very much surgeon dependent. So
right, right.
yeah.
So Ojtek is saying his 7-year-old daughter has a venous malformation the left side of the face. She's had 6-time laser treatments. We've taken an MRI. The brain is clear. Is there any problems we should expect in her life?
Well, if the venous malformation is very small, which I doubt in this case, judging by what you wrote, it's very unlikely that the entire malformation was taken out. So yes, we should go on with treatment because later on, especially during puberty, the venous malformation is very likely to grow further and cause pain, some kind, this depends on the patient, but very often some degree of disfigurement, and it might at times, though is pretty unfrequent, it might even bleed. So yeah, I would go on and consider sclerotherapy for venous malformation of the face. Yeah.
And just to clarify, for our Facebook Live sessions, we cannot review photos because the Facebook Live session does not allow pictures to come through. So if you want Dr. Coletti to review any images, MRIs, or photo, you have to email him directly
Yeah.
after the Facebook Live session or myself. And I thought I made that clear, but if there's any confusion, I just want to say, if you're wondering why we're not seeing pictures, it's because this app doesn't allow it. And we really wouldn't have time to be looking at photos because we have a number of questions coming in. We have 43 people on right
Yeah,
now.
but
So,
I will be really more than happy to
yeah.
review your case. And
Yeah, so Joni's saying she was the one with the leg lesion that the bleomycin has not
yeah,
worked.
bleomycin is not, this is my personal experience, will not work in AVMs. So as far as sclerotherapy is concerned, the only one that is going to work in AVMs is ethanol, pure ethanol, very aggressive. But the only one that is going to have any effect as far as killing the nidus is concerned.
So hi to Scott. He's just returning from his tour in Guam, so we're happy you're back and safe, Scott, and thank you for serving. Alisti Oliveri is from Peru. Is there possibility after laser therapy gets cancer as they age?
No, no,
There's no correlation.
no, not really. Absolutely, not at all. Don't be worried by that.
Okay, so Ida has a question. She said, apparently her son's been diagnosed with a VM, but she's suspecting it's a hemangioma. And that's
Yeah.
something simple that if she sends you the picture
Oh,
and
yes.
the history,
But
or me, that we can tell her what it really is.
for just to begin with, was it present at birth? Uh, if it's a hemangioma, an infantile hemangioma, it's very unlikely that it was there at birth. If it's a venous malformation, it's much more typical, although many venous malformations just become apparent later on during life. But also the clinical appearance of hemangiomas and venous malformations are quite different because the hemangioma, for its nature, is a mass, is something firm. The venous malformation is something very soft and compressible.
Spongy. They call it spongy. We call it spongy.
So I need to take a look at the pictures and the images if you have them, but the differential diagnosis is usually very easy.
Oh, hi Kiana, she's on from Trinidad. I always like to see our friends from Trinidad log in. And Jody has a question, why are some port wine stains more stubborn than others?
Yeah, this is a very good question. I don't think that some port wine stains are more
stubborn.
Yeah, they change during life. So they're just right after birth. They usually are very thin and light, but with time they become thicker and they become darker. So usually it's a matter of time. Yeah.
So Ada, again, now she's saying her son has a VM, but when he was born, it was just a bruise. He has a port wine stain on entire arm.
Yeah. Again, yeah, but again, I have to see the picture,
the history, any imaging studies.
Yeah.
Can you scroll? Because I think we have a bunch more. Yeah, so Michelle says, thank you, having it done in Children's Hospital in Pittsburgh. That's good.
Yeah.
Zika is saying her son has been diagnosed with a VM on his left side of his face. He has been referred to GOSH. We will see the doctor in a few weeks. What questions should we be asking? Is there any evidence to support that we should treat earlier? He is 4 months old. What treatment options are available? Okay.
You have to have your son checked by some very experienced doctor. This is crucial. As far as the indications for treatment go, usually there is no hurry. There is no reason to do it urgently or emergently, but I do share philosophy with other colleagues in the world to treat them early. The reason being that if you leave venous malformation untreated, this venous malformation will expand with the baby and become larger afterwards. And it will cause pain because the blood inside the venous malformation flows very improperly, I should say. This causes episodes of localized intravascular coagulation and this clotting, basically. This causes inflammation. Inflammation causes pain, and this pain and the inflammation causes even more enlargement of the malformation. So I treat them early on.
And it's funny because the next question is pretty much right on that. Is there a chance to get relief from pain? I was diagnosed with fibroadipose vascular anomaly.
Yeah, yeah. You could usually it depends on where you create, Chris, have this malformation. Because if it's a small one in a easy to surgically approach site, then we can remove it and then you will be free from your disease. But otherwise, if it's extensive, then you probably are best out with some kind of compression, especially during night.
Like a compression garment.
Yeah, compression garment. Yeah.
Okay. So Pat's saying my grandson was born with a lymphatic malformation, has had some surgeries in New York City. His cysts are microscopic or
Yeah,
microcystic
micro. Yeah.
on the left side of the face. So numerous problems from these cysts in nasal area, inside mouth, and behind eye.
Yeah. Microcystic lymphatic malformations are can be very difficult to treat. The reason being that while macrocystic malformations will respond so well to sclerotherapy, the small cyst will not. So we have our treatment protocol, our step ladder protocol to treat microcystic or mixed lymphatic malformations. And usually we rely on interstitial bleomycin for some of the lesions. Sirolimus is very effective in reducing the oozing from the vesicle that might take place, might be in the oral mucosa, and then surgery to remove or reduce the bulkiness that is sometimes caused by the presence of lymphatic malformation. So it's not, you know, we have again to tailor our treatment to the single patient.
So Jacqueline said her granddaughter goes to Berlin for operations and treatments. They live in Milan. Will Professor Weiner be joining you in Milan to do treatments?
We don't know.
But you don't really need him because you can do what he does, right?
Well, let me tell you, I respect and love Dr. Weiner is a very close friend of mine, and you are in great hands. If you prefer to be treated in Milan, just come here and you know, you will get in contact with me and we can discuss your case with Dr. Weiner.
Yeah.
But of course, if you go to Dr. Weiner, you are in great hands.
Right, but Jacqueline should know that we're launching VBF Italy through Milan
right.
to let the families know that you are here to do these lymphatics, venous, hemangioma, and port wine stain surgeries. And how long have you been doing them?
Yeah,
For
many years.
Yeah,
many years.
And
many years.
We are here because people who live in Italy didn't know about this. So that's why we're here to make them aware of you. So Ada says, I am suspected to have hemangioma because the pattern when he was born, it was just a bruise. Then got bigger. Now it is really big. His hand is swollen. He does not move his hand anymore.
So,
I mean, I don't know how old he is.
yeah, exactly. I was just asking how old is he now? Because, you know, Dr. Linda can tell you, hemangiomas have a very peculiar way of growing very rapidly, but then they stop and they tend to involute, which doesn't necessarily means disappear, but they do involute. So I would expect if he is 9, 10 months of age, some kind of spontaneous battering of your son. Yeah.
I'm not sure what that additional question is from Pap. It also suffers from scar tissue. So that was part of another one. I'm just not sure. Hi, Tanya. Courtney Hopper is on, and she says, is it true that a congenital hemangioma will not respond to medications? Also, is the next best option laser for congenital hemangioma on the face?
It is true that congenital hemangiomas will not respond to propranolol, not to medications in general, because the way propranolol works on infantile hemangiomas is very peculiar, and it's not the same with congenital hemangiomas, which they look similar but are completely different diseases. So no, they won't respond to propranolol. Your question, is laser the best option? I cannot tell you. I should see the picture, because if it's just some staining, yeah, laser is the way to go. But if there is some bulkiness, some excess tissue, then it has to be removed. I don't know if I answered your question.
Yeah, and I'm posting Dr. Colletti's email now for the person that just has asked it.
Yeah.
But we've also posted it throughout the post, but we have a lot of questions. You can see that I just posted, it's giacomo.colletti@gmail.com. Roxanne says, I have clipple syndrome of the right lower limb, have undergone several hip replacements due to necrosis, suffered multiple infections, blah, blah, blah. I understand. Had spacer removed and no hip for complete healing. Now have leg
Yeah.
discrepancy. Who would you recommend as a surgeon to contemplate leg length and replacement of
Yeah, we have here in Milan an outstanding orthopedic surgeon, who I work with, and he's dealing. He has a personal approach to correct leg discrepancies in KAT, in Trenone, clipple Trenone, and I would definitely go and see him for this reason.
Let's see the next one. Okay, this is great news for us that live in Europe. See you in Greece, and Dr. Colletti. Yes, great. Yes, okay. Thank you. Tanya says, hi. My mom, Batul, we know her bleeding when defecating. She has an AVM.
Mhm.
And as you know, yes, in her pelvis, should she take any medication? The other thing, Tanya, is to tell your mom that Dr. Coletti is that
Just
something you could treat?
no,
No,
no.
so that's extremely.
I'm a head and neck.
Okay, who do we have anybody here?
Yes, you know them, our friends in Italy who deal with um, arteriovenous malformations of the
Extremity?
body. Yeah, this extremity. One is Carlo Gandolfo, for
Okay.
instance. Then
Wonderful.
yeah, but we have many. Yeah, you
Okay,
can
but-
write to me and I can
Okay, so
just
yeah, Tanya, have your mom write to Dr. Coletti. We've posted his email a couple times here, and he can put her in touch, which may be easier for her, is all I'm
Yeah.
saying, instead of having to go to the States. I'm just saying it's an option. Sorry, why is Port Weinstein changed during the day? It comes and goes.
Yeah, it will not just change during the day, it will change with temperature, for instance, because port wine stain, the very typical histological feature is dilation of venule of the post-capillary bed. So whenever you have some dilation of this venule, the port wine stain becomes more apparent, more, more bluish. And this again is very typical. But with laser, you can obtain very good results in reducing this change during the day and during the seasons.
So Jocelyn has an interesting question I can answer based on Dr. Geronimus and Dr. Nelson's opinion, which is she's 8 and she has port wine on her leg from her hip to her ankle, and should she get treatment? So Dr. Geronimus and Dr. Nelson treat entire bodies of port wine stain in infancy, because they can treat that leg.
Yeah.
When it gets old, they get older, it gets harder to treat, because the more distal, the farther away,
Yes.
the harder it is to respond. They have to undergo so many treatments for a marginal amount of clearance. So
Yeah.
if it doesn't bother her, I mean, some extremity port wines stay the same, some do thicken. she can get a test spot done.
Yeah,
I'm really not sure.
I would. I think I would recommend treating any port wine stain because chances are that over time, within years, she might develop some angiokeratoma, they call them, which means some excess tissue over the port wine stain. So laser treatment prevents some these angiokeratomas to take place over the PWS. So yeah, you should seek treatment. I would do it.
So Alex is from Berlin. Hello from
Hi,
Germany.
Alex.
Hello. And he said, have you had any options for AVMs of the right arm with heart problems for treatment? Not only embolization, my daughter's now becoming very worse.
Yeah, I think that if I understand uh, right, the problems might be caused by the steel syndrome that the AVM is causing. So yes, there is not only embolization. Embolization is a good tool, but ethanol injection might do better for her. So that's what I would do.
So you can email maybe some images
Oh
and
yeah,
studies to you
oh
to
yeah.
take a look at. Jasmine says she has a birthmark on half of her face. She's been made fun of all of her way to high school, but it's a bit different. It's brown and a little bit raised. I wish I could afford getting laser treatment, but that's life. Well, first of all, Yasmin, that's not a vascular birthmark. It's
No,
called a congenital nevus.
nevus. Yeah,
They do not respond as well to any type of laser,
no, not at all.
but there are some treatment options.
Many.
And
But again, Jasmine, send me some pictures, and I'll try to give you my best advice on how to hopefully get rid of your birthmark. Yeah,
okay. So Sami Amandisha has a 3-year-old daughter who has a bilateral Sturge Weber.
Serge Weber.
The middle of her left cheek feels warmer than the right. We can also see a deep purple vessel on it. The MRI couldn't find anything abnormal. What do you think it is? What specific test can we do to find it out?
Mm-hmm. You don't really need to do any specific test. That might be a pyogenic granuloma, which is very typical to appear over a port wine stain, which is the basis of a Sturge Weber. Again, laser is the treatment to seek for port wine stain in general, but surgery is the preferred treatment to remove bleeding pyogenic granuloma taking place over a port wine stain.
And can send you a picture.
But yeah, send me a picture.
Yeah. But if it's just a flush and they feel like a pulse or a lot of heat in it, could that be an AVM instead of a port wine?
Yeah, you know, in the field of vascular anomalies, anything can happen.
Right.
But I haven't seen an arteriovenous malformation in a Sturge-Weber syndrome, but I know that some have seen some
Okay.
AVMs, so anything can happen. I should take a look at the picture and perform an ultrasound with my device in order to rule out an AVM, which would be, yeah, the most dangerous thing. Yeah.
So Melanie's, hi, hello from Canada. Her daughter is 8 years old. She has a VM in her right leg. It's deep, also in the bone, tibia. Can't see it from the outside. She's had 6 sclerotherapy treatments when she was 4. She's scheduled for 6 more starting from the end of February. Do you think treatment should only be when she's in pain? That's what our doc does. Or should it be treated now while she's younger so it won't grow bigger?
Yeah, I think I've answered to a similar question before. And again, I don't think that we should treat patients with venous malformations just when symptoms take place, because we can reduce substantially the malformation And this should be our aim in order to prevent the symptoms to appear. Because again, when she will grow, your daughter, if I took it right, your daughter will grow, the malformation will grow with her, and it will be more difficult to contain. It will be possible, but it will be more difficult.
This is interesting. Now, I'm curious about this, what Megan's saying, because she's saying, I want to thank you both, but we found out our dermatologist doesn't like to laser babies, but there's no physical reason why he cannot be lasered. She was using his brain AVM as a reason, but his neurosurgeon said he would be fine to be sedated. So now we are looking for a private clinic. So I'm thinking now that AVM of the brain, cutaneous stain, a syndrome here,
Yeah.
and that maybe we need to be, they may need to be looking at some
Yeah,
kind of
you
a
know,
syndrome.
first of all, you have to be sure of the appropriate diagnosis, because if there is an AVM even outside the brain, then I'm not so sure that lasering it is a good idea. On the other side, it might be that this is a syndrome and that is an associated capillary malformation, and that would respond very, very, very good to laser. So first of all, we have to have the appropriate diagnosis. So a stain can be anything. You have to have a precise diagnosis before you decide to do anything.
Nagawa has a question. She wants to know what's the best treatment for KHE, Kaposi form of hemangioma and
Yeah, okay.
mesothelioma.
This is an intriguing question, because KHE needs treatment for at least three reasons. The first of them is the bleeding, and bleeding can be stopped by removing the KHE or embolizing it. The second is the platelet steal syndrome, which goes by the name of Kasabek-Mered syndrome, or syndrome. And if there is a Kasabek-Mered syndrome, which is a platelet steal syndrome, paradoxically, you don't have to give the patient any platelet, because all of the platelets will be stealed by the tumor and will increase the size of the tumor. So the treatment for Kasabek-Mered is today, even if in the papers you read that vincristine is the drug to choose, sirolimus is better tolerated. So for Kasabek-Mered, I would go with sirolimus, and I would go with surgery or embolization to remove the mass or stop the bleeding.
And that sirolimus, is that a chemotherapy agent?
Not really. Sirolimus is rapamycin, falls under the family of antibiotics, is macrolide. It was used in the 60s to prevent immune reaction against kidney transplants. But now we know that it works by stopping protein inside the cell, which is called mTOR, mammalian target of rapamycin, which in turn is a promoter of angiogenesis and cell turnover in general. So sirolimus is very effective in KHE, and especially in Kasabek-Mered syndrome.
Okay, Mizuki, she said, hello, we live in Malta. Oh, it's a beautiful place. It's on my wish list. And the last laser treatment we have done with my son was in June. Oh, that's okay. That's why the name sounds familiar. Thank you again. Anyways, we'd like to start up again this year. Are you our closest doctor for port wine to Malta?
Well, I think Malta,
in our network,
in our network,
and for the 450 euro flat fee,
So you're very welcome to come and see me. I think so.
Yeah,
I think
try
yeah.
treatment, see how it goes. It's no anesthesia.
No anesthesia,
So, yeah.
numbing cream, and that's
Yep.
all.
So Ad, Ad, Adobe,
Yeah.
Emanuela Nijuku. Her son was born with a rare form of vascular anomaly. He's 4 years old. The condition has remained undiagnosed. Okay, so you can send his photos
Yeah.
and any pathology imaging studies to Dr. Colletti.
Yeah.
Kristen just posted it to the email before where it says birthmark.org/VBF expert Colletti. So you can see that as the email right before yours. So you can send him directly from there. April said her daughter has Sturge-Weber syndrome and has a large point wine stain covering the right side of her face. She gets pulse dye laser treatments, and after one, she's developed bad blisters that cause scars on her face. Her dermatologist is treating her scars with CO2 laser, as well as continuing the treatment with the PDL. Can you give recommendations on what we could do to treat her scars?
Yeah, it depends on the size of the scar and the quality of the scar, because if the scar is very wide, its dimensions are big enough, then sometimes removing them surgically is the way to go. Otherwise, trying to resurface scar with CO2 is a good thing to do.
Zika wants to know who you know at Gosh. I know they have a vascular anomalies center there. I just don't know. I can't think right now the name of
No,
the
I don't have a name to.
Yeah.
No.
But if they can Google it and find it there. Okay, so Jennifer says, hello, I'm 39 years old. I have a port wine on the left side of my face. 7 years ago, I was told that having any more laser treatments would be pointless due to my age and thickening. Does age hinder getting any results from treatment? Wow, that's totally wrong.
Yeah, that's wrong. And also, let me tell you, do not listen to those who tell you that you don't have to have any more laser treatment. You have to have them in order to prevent hypertrophic transformation of your skin and the skin adnexia, which will become very apparent, evident, and unsightly over time. So do have some laser treatment.
And just go to someone who knows what they're doing, get a test spot done,
Yeah.
and see the result. So, hi Eileen. Eileen.
Hi, Eileen.
Our friend Eileen O'Connor just signing on from Boston. Winter just joined us. Hello, Winter. Stephanie. Hello, Stephanie. Hi, Stephanie. Oh, you can't hear us? You should be able to hear us. Everybody else can hear us,
everybody
right?
else
I
is
think
hearing us,
everybody can hear us. The older you wait to have laser, the more, well, it's not, according to Dr. Nelson, it's not that it's more difficult because every port wine's like a snowflake. They're different.
Yeah.
So if it's a thin port wine stain, a faint port wine stain, and you start later, it's going to have a quicker result. If it's always been a confluent, a thick port wine, and then it gets thicker, and then you take it, it's going to take more.
Yeah.
So,
but as a general statement,
yeah,
the sooner you do it, the better, because when the child is very young, before 6 months of age, the skin, the dermis, is very thin. So, in order to reach those diseased vessels, you need a lower energy to reach them and to obliterate them. When the dermis thickens, which happens after 6 months of age, and it's going on all through the life of the patient, then lightening the malformation becomes more difficult. So yes, the sooner you do it, the better.
Now, Alana has a good question. She's from Serbia. Can you treat hemangiomas near the eye, right under the eye, without the general anesthesia? And I think she's meaning with the laser, and I don't know if she means port wine or hemangioma.
First of all, it is not necessarily true that a hemangioma needs treatment. So again, I should see the patient. A hemangioma of the eyelid is usually needs to be treated because of amblyopia that it could cause. Laser is not necessarily the first treatment that comes in mind when as far as hemangiomas are concerned. But if it's a port wine stain, then yes, you can do it with a corneal shield.
Right. And you'll have your corneal shield
Oh, yeah.
soon. Yeah, I mean, so, and then remember everybody, Dr. Colletti will be with me with our other experts in Greece, in Athens, Greece, in June, where we will have a free laser clinic and a free diagnostic clinic. So you can look for that on our website at birthmark.org/Greece. Okay, so Tali just joined us. What is the difference between the V-beam and the YAG, and when should the YAG be used?
Okay, they are totally different. They have different indications. The YAG laser, also you have to bear in mind that there are different kind of YAG lasers as well, because you can have the erbium laser, erbium YAG laser, or the neodymium YAG laser, which you are probably referring to. The neodymium YAG laser is wonderful to treat venous malformations, very powerful. The V-beam laser is used to treat capillary malformations. Different actions, different indications.
Hello from the Netherlands. Indra, she wants to know if she can ask you a question about CMTC cutis marmorata.
Yeah.
And she wants to send it to you because it's a long story.
Yeah, write to me.
Yeah. Hello, Maria. She's saying, praise the Lord
happy
for your teaching. Hi, Maria. Maria Larson, she's been with VBF for over 20 years. Hello, Shannon. She says she's 47 years old from Saskatchewan, have had 12 PDL lasers between 12 and 26. I'm not sure what your question is. You can ask your question. Karen is from Peru. I have a hemangioma in my right leg from my hip to my knee. When I was a child, my mom took me to a hospital where they took me a blood sample. It's so painful, but at the end they told me that what I needed is a laser treatment, but no one will do it. I've never been treated. So I'm thinking she doesn't even have that, right? I'm not a child anymore, thank you. So it's likely a possibility of KTS for Weinstein, and definitely
likely.
not hemangioma.
No.
Yeah. So you'd have to send your pictures and your story.
Yeah, write to me.
Yeah. And we have all of our posts. Hello, Elizabeth. She's one of our newest board members, and Dr. Colletti. She's enjoying it and thanking us. She actually has, she's a nurse, and she worked with Rox Anderson, actually, one of our true laser experts. She has a port wine stain on her face, her right arm, and her chest. And she's had V-beam treatments throughout her life. Her mom declined any offer to do imaging of my brain. I have no symptoms. At this point in my life, should she? Yeah.
You don't have any Sturge-Weber?
No. Grigor said, good evening. Can doctors from Russia attend your Congress? Yes. Yes, you just register.
More than welcome.
Yep, for the conference in Greece in June. Yes. We highly encourage you to come. And the link for that conference is, sorry about that. The link is at birthmark.org, or Kristen or someone, if you can post the link for the Greece conference on here, I'll let people know that you've posted it. And
I think this is Turkish. I don't understand that.
Oh yeah, I don't know. Oh, they have Sturge-Weber.
Yeah.
And
32 years, I think.
Yes, at 32.
But
so it has to write in English. We also have a Sturge-Weber expert on the VBF website, Dr. Comey, who's more than happy to answer questions. Hands deep in ice cream when you said hi. I can't. Well, maybe we have to go get some gelato.
Oh yeah, we will.
In Milan. Please connect me with Jennifer. We have plenty in common. Okay, Shannon, you can just scroll down and up through here with that person, Jennifer, that you're talking about. and you can post so you can get in touch, or you can write to me, Dr. Linda at birthmark.org/Dr. Linda. Megan said Dominic has had several stains, and we've had two separate diagnoses, the brain and hepatic AVM. As far as pathology is concerned, they're separate to his skin hemangioma. Dominic is a baby with, the hundreds of ones that you saw the picture of with
Yeah.
the hemangioma.
Yeah. Hi, Megan.
Yes.
I know you.
Yes. He's just so rare and different than anyone has seen. We're just trying to get his bleeding under control. After speaking with you both, I think we may need to travel. Yeah, I agree. I'm not sure where you live, but I think you need to see an expert in Boston or in Europe somewhere where they're experts in diagnosing and getting him on the right treatment plan.
I'm here for you whenever you want.
Yeah. Thank you. So Rebecca says, hello from Arizona. Do you deal only with vascular birthmarks? Just found out my 8-year-old daughter has a type of VM in her thigh. Well, that is a vascular birthmark for us.
True.
And it's very painful. It's in her femur.
Yeah, this again is very typical. We see venous malformation which are located entirely inside the muscle. The pain comes from, as I told you before, very often from coagulation that takes place within the venous malformation. There are very good solutions to your daughter. One is sclerotherapy. If sclerotherapy does not work, then surgery can definitely help your daughter recovering and not having any pain again. Yeah.
So we have only 9 minutes left, but Dr. Colletti will be happy to take your questions if you want to email him directly after this session.
But not in Turkish, please, because
yes,
I don't understand Turkish.
Not in Turkish. And also, this session, you can play it back at any time, as well as any of our 20 sessions that are on our Facebook page and on our page at birthmark.org with other world-renowned experts like Dr. Weiner, Dr. Geronimus, Dr. Nelson, and you will learn firsthand from the experts about diagnosis and treatment. So April's saying the scar is about on the forehead. You only...
I have to see a picture, April.
Yeah, and then a couple questions in languages we don't understand. Thank you. See us in Greece. That's great. 15 years old from Greece with deep veins, thrombosis, port wine stain. She has to take blood thinners. That sounds like it might be a copotronane or some extensive malformation of the extremity. Come to our conference. It is free to come to the clinic. So again, the family that's writing on here from Greece, come to our international conference and clinic in Greece, June 7th and 8th. And the information, I've asked one of my staff to post it here, so it should get posted shortly. Laura McGinnis, do you recommend anyone to treat an extra cranial AVM in the right temple feeding down face?
Yeah, the answer is all AVMs need to be staged. So according to our staging system, it's gonna be published soon. According to our staging system, there are AVMs which have indications to be treated and other AVMs that must not be treated. So I have to see the case. A single case.
Yeah. So Mizuki has a great question for you. She's really happy about coming for treatment. They're going to be there for 2 weeks. So they want to know if they get one like the first day, can they get the second one 2 weeks later? Because I know Dr. Geronimus does that. And he'll even treat right over purpura.
We can do it.
So great. So she can schedule that with you. Bayron said, 32-year-old. Okay, it's got to get translated into English for us to read it. Or Italian. I can't read. Stephen says there will be a complete cure for birth. Praise God. I'm praying for that, Stephen, as well. So many new drugs are coming out and gene therapy, and we're going to be so excited This October at our conference in California, we have Dr. Drolet coming to talk and some new presentations that we're excited about. I don't know anyone in Saskatchewan, but I'll tell you what, Shannon, next year the ISFA conference with all the top docs
Oh, yeah.
in the world
That's
is
true.
going to be in Toronto. At least it's in your continent. I know it's far, but okay. So this person's saying they're not sure if it is Klippel-Trenaunay Weber. Again,
Mhm.
you'd need to see images and studies. What is, oh, the Primo laser. So
Yeah,
that's the one.
this is interesting. The Prima is a new machine developed by Candela, which has the ability to fire PDL and neodymium YAG laser at the same time. So it has some different indications. It's not necessarily better to just treat a port wine stain, but it has some indication for other diseases.
So Vika is speaking in Spanish and saying
Mi
that,
hijo tiene síndrome de Klippel-Trenaunay. Yeah, she has
yeah, a 12-year-old
yeah,
with
12-year-old necesita ayuda. If you can come here or just start by writing to me, we will try to do our best.
Okay. So Laura lives in Indiana, hasn't seen a neurosurgeon, but he hasn't know what to do with her. Oh, he doesn't know. You know, again, there's a top team in New York City too, and she can even talk to Dr. Comey or somebody on the VBF expert team. Email me. I'll give you a direct email to somebody. Steven says he has a port wine stain all over his face. Went for laser at Newcastle, UK. I went for about 8 years and stopped as it wasn't working. Lasers have changed in the last 8 years,
Yeah.
and the settings and the parameters.
Yeah.
If you want to go to Milan and get a test done and see how it would work, you could try it. It's worth a try. Or you can come to Greece and get it done for free. But you have to register at the VBF conference for Greece at birthmark.org if you're interested.
Yeah. Santana Kelly is writing to us in Portuguese, but I do understand it. That is a Sturge-Weber syndrome. You have to know this. That is a Sturge-Weber syndrome, and it has to be treated. Yeah.
Okay. And again, if I see someone from my staff is posting, if you can please post about the conference in Greece, the link for that, Kristen or April, I would appreciate that. Oh, there it is. I see it, the Greece conference link. Diane said she's a 59-year-old woman with a port wine covering her right leg and calf to waist. Yeah. Is there a laser that would help me to lighten or take it away? It's just
there is
hard. I mean, you need a test spot done on it too, because it is harder when you're older, and you'd have to see how confluent and thick and but a test spot. So, and then this person in
Georgios, that is Greek. So we have laser on port wine stain. Yes.
Come to the conference.
Yeah, come to the conference.
And get a free consultation.
Next June.
It's in this June. So we only have 2 minutes left. So Andrea's writing. Her 5-year-old has a venous lymphatic malformation of her left arm, hand, and chest. Most extensive part is on her elbow. She is left-handed dominant. On Tuesday, she took a fall on the elbow. Wednesday morning, she woke with 2 new large bumps on her hand. She was unable to use it. Last night, in the middle of the night, she complained her arm hurt and she couldn't straighten it out. This morning, she was in a lot of pain.
This is a very long question. Just write to me, please, because I don't think we have the time to answer that.
Yeah, you'll have to write. Can stem cells be used? That's discussed and being worked on. Nothing right now to report on stem cell treatment, but I know. Okay, so Shannon.
See you in Toronto, Shannon.
Yeah, it'll be posted on our website in the next few months. So about the conference and the ISFA conference. And I guess we can take, let's see, would laser treatments help with scar tissue? Yes.
Yeah. Oh, yeah. And Aniko asks
about
us if we do
under general anesthesia.
we prefer not not doing it under general anesthesia, but we can discuss this. If you, again, if you write to me, I will explain you the options that we have.
Yeah. And these are some of our regulars. So I think at this time we have to sign off. So
Yeah.
thank you from Milan. Ciao.
Ciao.
And I hope to be back again. So thank you, Dr.
Thank
Colletti,
you.
for joining us. And
Thank you to all of you.
And again, if you want to watch this, go ahead and listen. And last time, the great news, Dr. Colletti is now offering pulse dye laser treatments in his practice without anesthesia for 450 euros a treatment. And his contact information is here. Contact him, schedule the treatment, see how you like it. And also you can see him and myself in Greece, June 6th and 7th. Take care and have a great winter. Bye.